First, we're starting with a story that should worry every single household. In Indore, drinking water meant to keep people safe ended up making them sick. Sewage mixed with the main supply line in Bhagirathpura. By the time authorities caught it, the damage was already done. At least 15 deaths have now been linked to contaminated water. Thousands reported diarrhea, vomiting and fever. Children and the elderly were the worst affected. The outbreak spread before the source was even identified. And this is not just an Indore problem, remember. Several such reports have surfaced from across the country. Water contamination happens when old pipelines run next to sewage lines. Loose joints and cracks allow sewage to enter drinking water. Low pressure further pulls contaminants in and add construction damage and poor inspections, and you have crisis waiting to happen. And that's exactly what seems to have happened here. Nationally, the crisis continues to escalate. Nearly 70% of India's water sources are contaminated, and India ranks near the bottom globally on water quality. There is still no public ranking of cities based on drinking water safety. Clean streets do not guarantee clean water. So what should you watch out for at home? Cloudy water, sewage or rotten smell, sudden bitter or salty taste. If multiple people fall sick, stop using tap water immediately. And what should we as citizens demand? Regular water quality reports, immediate action on complaints, free treatment during outbreaks and accountability for delays. So joining us to take this conversation forward and really decode for us what we're seeing, what can be done, how can we prevent this the next time going forward. We are joined by Dr. Chandrakant Lahariya, who's an epidemiologist. He is our first speaker this morning. Good morning, Dr. Lahariya. Also joining us is Nitya Jacob, Water Policy Analyst. Thank you to the both of you. It's an important conversation, a conversation that's been shaping up slowly in different ways across the country since the end of 2025. Mr. Jacob, if I can begin with you, is this people not being denied their basic right to live? It's literally tied to your constitutional rights, and here we're taking something as serious as contamination for granted. Before people, don't fall sick, deaths are not reported, it goes unwatched, unchecked. What do you think has been the biggest problem when it comes to water contamination crisis in different parts of the country, let alone Indore? But overall, what do you think is happening? Is it water quality alone? Is it infrastructure? Is it urbanization? Where do you think the biggest fault lies?
Hi, Christine. Good morning. Yeah, I think you bundled a lot of questions into that one statement. So I'll try and take them one at a time. I think there is a UN Charter on basic human rights to safe drinking water and sanitation. India, unfortunately, did not sign up to that. So we are not bound by the Charter. But you're absolutely right that safe drinking water is part of the right to life. And therefore, it is one of the fundamental rights that citizens have. Safe drinking water basically means water that does not make you sick and that you can drink without treatment directly from the source. Unfortunately, no Indian city, leave alone villages, have been able to provide safe drinking water to people. And I think how it was summarized at the beginning of this program was very nicely done. The causes of contamination of drinking water, there are so many of them. The biggest one, of course, is the way the water infrastructure has been laid out in cities and villages, where drinking water pipelines either run in drains or they run next to sewers. And because of intermittent supply, when the pipes are empty, this dirty water, the sewage or other contaminants enter the pipelines, and those are then supplied to people. Sorry. Water quality testing has been extremely deficient. So even though we have a network of laboratories, water quality is usually tested at the point of supply, not at the source. And source testing is done randomly. If someone has the problems in their drinking water, they can get the water quality tested, but it's not done systematically. So people are supplied what may be clean water. By the time it reaches the customer, the water may be completely contaminated.
Okay, that's an important one. Mr. Jacob, you're saying the problem is not at the source. The problem is by the time it reaches your home, somewhere there's contamination that enters the water supply, and this is the result. You end up seeing a lot of hospitalizations, unfortunately deaths in Indore as well. We'll take it one by one. I'll come back to you for more. Dr. Lahariya, from an epidemiologist's point of view and perspective, tell us, if we're looking at this community-wise, what are the early signs that are a big indication of how a water crisis could be unfolding?
So we can break this into multiple parts. The initial understanding is that we always look, for example, water supply in isolation. While ideally it should be looked holistically, as previous speaker also talked about water, sanitation and hygiene. And these are not just a health or well-being issue. These are the livelihood issue. These are school education issue. That if any of these are faltering, then entire system is affected. The kids will not be able to go to school because when they are falling sick, hospital attendance will increase. People will have diarrhea and lose motion. So we should first thing need to do is stop looking in isolation that okay, streets are clean or sewage system is functioning or wastage being collected is fine. Water is integral part of, we need to look holistically. Now when we will identify problem, I think India's challenge is that we have such a high burden of diarrheal disease like we colloquially or in a slang called Delhi belly, where anyone traveler going to any other city in India or a foreigner coming to India develop a diarrheal disease. So this is a baseline level of the waterborne illnesses is so high that it is difficult to pick up. And that's why it's important that we need to have a water quality check in this case at the source also, but at the treatment level, at supply and household level. So we need to work at all level, and we also need to look at the data when people like citizens are complaining. This need to be notified, and this should be a very quick nudge for the authority to test the water quality in that locality. The challenge in India is that people complain, but the infrastructure or system is not there to test the quality of the water.
So sticking to just what happened in Indore, Dr. Lahariya,
So
a lot of people mid-December or close to 25th December started complaining of foul smell, started complaining of bad taste, started picking on those early signs, and yet nothing formally was done, no strict action was taken. Possibly those lives could have been saved. And that's why I'm trying to ask you, what are those early signs as a community to spread awareness, to help people understand that this is something you must flag no matter what? What are those signs?
So if it's not late December, in fact, if we go by some of the media reports, by mid-July and in some cases again in mid-October, people started complaining. So that is the point. If the complaint of the people have a mechanism or system of reporting to the authorities, and then once this complaint comes, it should be addressed in the time-bound manner. So people complain in July, and only when the attendance at the nearest healthcare center increased many-fold or drastically, then only the authority got activated.
Yeah.
So we need to understand this thing, that responsive governance where any complaint is taken seriously and reported. And of course, we know that the quality of water, which is like clearly visibly contaminated, is reported not only from Indore but multiple parts of the city. You go to any area of the Delhi and then people complain that they have a water supply which appears very visibly contaminated or visibly not drinkable quality water, but then very rarely action is taken.
Okay, Mr. Jacob, it's a very interesting point. Contamination is seen as silent until it turns fatal. Unfortunately, that's what it came down to in the case of Indore, and possibly in the past in other pockets of the country as well. Mr. Jacob, let's talk about the water quality monitoring system. How robust is this process in India? How frequent is testing done? What about data? Is it collected at regular intervals? How transparent is the data? So tell us more about that.
So I think we have a huge network of public health laboratories which are supposed to do water quality testing. And they're supposed to test for things like biological contamination, chemical contamination, dissolved salts and things like that, at least twice a year. And then if there are cases like Indore or some other cities where water contamination is reported, foul smelling water, dirty water, then they're supposed to come in and test immediately. In practice, that doesn't happen simply because a lot of the laboratories don't have the chemicals, the manpower, the personnel and the wherewithal to do this kind of testing. So it's actually done by the water quality surveillance, if you want to call it, while it exists on paper, is not really very robust.
Yeah.
People can go to a laboratory with water samples and have them tested, but that's only if there is a suspected case of contamination. It's not done as a routine, even though it's supposed to be done twice a year, once before the monsoons, once after the monsoons. So, I mean, the short answer to your question is that the system exists on paper, but it is not very robust.
And I want to ask you what we can do at an individual level. So how can we begin from our homes? But before that, do you also think another big problem here is how municipal departments possibly work in silos? So you have, let's say, the road construction agencies dig up without coordinating with the water or sewage boards. Do you think the problem lies at that level?
Yeah, absolutely. I mean, there's so many agencies in every city, in every village. They all have their own budgets and priorities and work schedules. Nobody talks to each other. So a water pipeline that has been freshly laid and is in perfect working condition could be damaged by the digging of another agency like the power department or the telecom department. So there is need for some sort of coordination, but there's also need to understand where this underground infrastructure runs. And water pipelines usually run below roads, and that's where everything else also runs. But it's important for agencies to at least share basic data among themselves so that they know when they're going to dig something, there's a water pipeline there, or there's a power pipeline there.
Basically, it requires a lot of coordination among different departments across, and the lack of it is what has resulted in so many people losing their lives, so many people falling sick and currently undergoing treatment. Speaking of which, Dr. Lahariya, how much of, if clean water supply is accessible in all homes, how much of the healthcare burden could be lifted off then? And do you really think that water contamination more often than not is treated as an engineering issue than a health issue?
Water supply and safe drinking water is definitely health and well-being issue. Now, if we talk about the burden of illnesses due to water, unsafe drinking water, we don't have that kind of reliable data, but whatever data is available from hospitals, we know that an estimated around 2 crore of Indian people fall sick due to unsafe drinking water. They develop diarrheal and other illnesses. But there are other estimates available which are more specific on deaths related to diarrhea. And many of those deaths are due to the unsafe drinking water, which result in the spread of the various illnesses. And around 1.5 lakh children are estimated to die in India every year due to unsafe drinking water. But more than the deaths, there is a hospitalization, which is a burden on healthcare facility. So indirect cost on the government, and then cost on the facility. So there are direct and indirect costs due to deaths, disability, hospitalization on this thing. But more important point is that all of these costs are excessively high on individuals who are poor, marginalized, children, women, elderly.
To begin with, they don't have access to RO filters, for instance. Right, so something as basic as that. So if you don't have an RO filter and your water is contaminated, how do you have or gain access to basic clean water? And do you think then, Mr. Jacob, that this is a good
point here?
Yes, Dr. Lahariya. Sorry,
just a quick point here that if one of the good parameter of this is that if people have to order the packaged drinking water in their house in urban settings and even rich people, which definitely indicate that the water supply which is coming from municipal corporation and not the quality which it can be consumed, and then poor people need to rely on that water supply, and which results in increased cost of hospitalization. And that's why it's a moral responsibility of elected governments and municipal corporation to spend more and ensure that every drop of water which is flowing through the taps is of a drinkable quality.
Okay, very quickly, running out of time, Mr. Jacob, do you think RO filters have actually proven effective in cases like these? So if your water is highly contaminated and you have RO filters installed, does that guarantee you safe drinking water?
In a nutshell, it does. Okay. But I think, like Dr. Lahariya said, RO filters are an expensive solution. There are lots of other solutions which the Department of Drinking Water Supply has on its website. So if people want to take a look, it's available in Hindi and English. A simple act of boiling water before you drink it, or using chlorine tablets, or using an ultra filter, not an RO filter, but there are other kinds of filters that remove bacteria and viruses.
And this deals with all sources of contamination, so industrial, biological, anything?
Not so much industrial, but they'll certainly get rid of all the biological contamination, and that's what we're looking at now, because people have died because of E. coli in water. Industrial contamination is much harder to get rid of, but you can certainly kill off most of your bacteria and viruses that make you sick if you boil water, or if you use chlorine tablets, or you use ultra filters. RO filters are sort of like an extreme solution, but yes, they are definitely one solution. But I think, like what Dr. Lahariya was saying, it's a responsibility of the government to provide its citizens safe drinking water. So getting citizens to use these point-of-use treatments means that we are absolving the government of its responsibility. We need to hold the government responsible for providing us safe drinking water all the time. And that's unfortunately not the case anywhere in this country.
And Mr. Jacob, is there any system in place currently that guarantees citizens real-time data or information on water quality, just like air quality? Or can that be a possibility in the future?
It can be, because the pollution control boards in the country, the state pollution control boards, have their databases, and they are mandated to keep track of water quality. So if they simply have a citizens dashboard which provides not even real time, but even monthly updates on water quality, that would be an easy thing to do. Just like now we have data on air quality from many cities, we could have data on water quality from many cities. So it is entirely feasible, it's entirely possible. And we have the IT infrastructure to do it, and people have smartphones. They could easily have an app to monitor the local water quality.
Okay. Dr. Lahariya, very quickly, we're wrapping up this conversation, but for all those watching, since we're looking at lives, innocent lives lost here, a quick tip for anyone who senses a problem, thinks their water is contaminated, their body has reacted or sent out the first wrong signal. What is it that they're to pick on to ensure that they reach out to a healthcare professional at the earliest?
If you have increased incidence of loose motions in your community, not just in your family, or if you see that people are reporting a turbid or visibly contaminated water, it needs to be reported to the authorities. Loose motion, diarrhea, etc., especially to elderly and children, go to a healthcare provider and report the complaint. Of course, they might get some stool tests and other things done. So take care of your health, ensure you have a alternative source of water which is good quality or drinkable quality. These are some of the steps, and be aware what is happening in your community so you can take corrective measures.
The unfortunate part, and also the worrying part here, is that these problems persist as we speak in some of the cities that are considered well managed. So we're really going to have to zoom in on the problem and come out with concrete steps to address it before more lives are lost. Thank you so much, both you gentlemen, for joining us this morning. It's been wonderful decoding this story with you. Hopefully, we're taking notes and really working on this in days to come.